Thank you so much, Salma Salim, for that story, and our apologies for the fast introduction of the story. And if you want to get more of the following of the hearing, you can watch Horizon TV from 7 p.m. in the evening to get more stories. In an effort aimed at supporting and empowering breast cancer, KENYATTA University Teaching, Referral and Research Hospital held a 3 breast cancer reconstruction workshop program. The program, which was held at the hospital, brought together medical professionals and experts in the field of reconstructive surgery, both locally and internationally.
The workshop is part of KENYATTA University Teaching, Referral and Research Hospital's commitment to holistic patient care, focused on educating healthcare professionals and raising awareness about breast reconstruction options available to women who have undergone mastectomy procedures.
As you know, we have a big problem with breast cancer, and once the surgery is done, then a lot of patients are left with scars, with a flat chest, having lost their breast because of cancer. So we are focusing on breast reconstruction. And the reason why we are doing that is that we can give these women a new lease of life.
Dr. Muki, a breast surgeon at KENYATTA University Teaching, Referral and Research Hospital, highlighted the importance of such workshops, stating breast reconstruction plays a crucial role in a physical and emotional recovery of breast cancer survivors.
In terms of the diagnosis of breast cancer, I think we are okay. The treatment options are available, but like you have heard that we have concerns regarding the untimely presentation of patients, that most of our patients present in the later stages. We also have younger patients who present with breast cancer. So that's also a challenge. Then if the only option that we can offer these young patients who present late with breast cancer is a mastectomy, then of course we can see one of the challenges that we'll get is that they will not present, or we make the diagnosis and then they disappear.
The workshop featured presentations and live demonstration by skilled surgeons, showcasing various reconstructive procedures available to breast cancer survivors.
Honestly, after the breast cancer and surgery, you don't have to go showing everybody that you had an issue when actually you have healed. So that was our reasoning. The symposium is very well attended. As you can see here, we have breast surgeons, experts from different countries. We have experts from Argentina, from Canada, from Italy, from Ghana, and from US to come and work with our own breast surgeons.
According to Professor Olive Mugenda, the chairboard of KENYATTA University Teaching, Referral and Research Hospital, said the workshop program aligned with the hospital's broader commitment to patient-centered care, research and community engagement.
The rest of the week we will be actually operating on, I think, 10 women doing the breast reconstruction, and the doctors will be sharing their experiences. We have some doctors who have more experience than the others from other regions, and they'll be working with our doctors so that we can begin to build capacity. They share knowledge, share experiences, how to get the best outcomes. So that is really the essence of the symposium.
By providing a comprehensive platform for education and dialogue, the hospital aims to enhance the quality of life for breast cancer survivors and contribute to ongoing advancements in reconstructive surgery.
Most of the patients who are coming, they are presenting stage 3 and stage 4 cancers. And we feel that is really very sad. I hope in a few years or even sooner, we can turn around these statistics so that maybe the majority are seen at stage 1 or 2, or hopefully not even no cancer. But that means a lot of screening, early screening, a lot of education, a lot of talking to people so that they can go for tests. They can go for their mammographs, they can know how to self-examine themselves, but we can catch this disease early.
Reporting for Muslim Insight, my name is Kasim Mustafa.